I am Professor S.K. Sinha. I work at PGIMER Chandigarh in the Department of Gastroenterology. Today I am going to talk to you about a condition which is called inflammatory bowel disease. Typically, inflammatory bowel disease involves two classic patterns of disease. One is called ulcerative colitis and the second is called Crohn's disease. Ulcerative colitis involves mainly the large intestine or the large bowel which we recognize, and it causes ulcerations there only. So it typically involves the inner layer of inner wall of the large intestine, and it doesn't go spread outside, or it doesn't cause transmural. So it doesn't involve the 4 layers of large bowel. It involves only inner 1 or 2 layer. In contrast, when we talk of Crohn's disease, it can involve any part of the body, particularly whole of the GIT, starting from the oral cavity to anus. But more commonly, it involves the large bowel, small bowel, and the junctional area, which is called ileocecal region. And in contrast to ulcerative colitis, the large Crohn's disease involves all the 4 layers of intestinal wall. So it can cause more complication. It can be associated with a stricture or narrowing of small bowel, which can result into bowel obstruction. It can cause bleeding. It can cause perforation, which can be catastrophic, occurring, causing severe pain, abdomen, organ failure abruptly in a catastrophic manner. So Crohn's disease has much more varied presentation compared to ulcerative colitis. For a common person, there is always question arises that when to suspect inflammatory bowel disease. So there are certain warning signs we talk. So the warning signs are if you are having blood in stool, or red color stool, or somebody is having pain abdomen and very frequent stool. So these are the signs when one should suspect, and particularly when these signs persist for more than 2 weeks, we call it chronic diarrhea. And when it is blood mixed or there is evidence of inflammatory component, then we call it chronic inflammatory diarrhea. So that is the main sign one should consult. So imagine a situation, some patient is having diarrhea for lasting more than 2 weeks, having pain abdomen, having have noticed blood in stool, and have started losing weight and not feeling well, or some degree of pyrexia or fever also can occur. So these are the typical situations when the public should suspect that he requires further investigation and he needs to consult doctor, and by doctor here we mean he should consult gastroenterologist. So what the doctor is going to do? So doctor is going to investigate. There are certain stool tests which are very helpful, like a stool examination, a stool for blood, a stool for inflammatory substances like fecal calprotectin, fecal myeloperoxidase, fecal lactoferrin. So these are stool based tests which can be done in most Indian cities now, and fortunately most of these can be done without a specific precaution. So patient can just collect the sample and quickly transfer it to the lab, and it will be done, although some of the tests can be expensive. But the cornerstone of the diagnosis or confirmation of diagnosis is endoscopic examination. And when we talk of ulcerative colitis, this endoscopic examination is colonoscopy. So it can be limited colonoscopy, which is also known as flexible endoscopy, or it can be full length colonoscopy, which examines whole of the large intestine plus part of the small intestine, which is the process is called retrograde ileoscopy. So this is very good test for diagnosis of both ulcerative colitis, almost 100% will be diagnosed, and also an extremely good test for Crohn's disease. So most of patients will have changes either in the colon or internal ileum, but a small percentage still can escape detection by colonoscopy and retrograde ileoscopy, and these patients will require other forms of investigation like CT scan, CT angiography or MR angiography, capsule endoscopy, and other type of imaging modality. So whenever someone is diagnosed with IBD, inflammatory bowel disease, we try to, as a physician, try to do 2 things. One is to map out the disease, that what are the segments of bowel are involved. So it is only a small bowel, it is only large bowel, or a combination of the two. And then what is the severity of the disease? So severity is very important because initial treatment is determined more by severity, and long-term treatment is more determined by the distribution of the disease. So most of the time when the patient is started on treatment, it is long-term commitment, 5 years plus. Sometimes it can go even lifelong treatment. So that is very important to understand, because this is a chronic disease, has a waxing waning course typically. So patient, if started feeling well after maybe say for 1 month or 2 months, he should not be in a dilemma that his disease is getting cured spontaneously. Most of the time it comes back after gap of maybe few weeks, maybe few months. So one must consult the doctor, follow the advice, keep on taking medication even if his symptoms are completely controlled and he is feeling absolutely well. There are certain precautions which requires to be taken at the patient end. One is like these patients should be careful about the diet. Diet affects the disease course by multiple ways. If the diet is not hygienic, a recurrent episode of GI infections can happen that tend to cause symptoms per se of diarrhea, pain, abdomen, but also that tends to precipitate acute attacks of inflammatory or acute exacerbation of inflammatory bowel disease, either ulcerative colitis or Crohn's disease, and that can take several weeks or months to resolve. So diet should be very hygienic, should be clean, should always use clean filtered or boiled water, and then spice content should be in moderate. Most of the time we say that milk should be avoided at least during the phase of active disease. The second precaution, which is very common, because in India many drugs are available as over the counter drugs, and everybody has tendency to consume lots of anti-inflammatory drugs. So those drugs cause minimal injury or minimal risk in general population, but in inflammatory bowel disease patients it can be very dangerous, and that can precipitate acute attack, and if the drug is continued will be difficult to control the acute attack. So NSAID drugs are a complete no-no for the patients of inflammatory bowel disease, so that should always be kept in mind. These patients, because they have involvement, Crohn's disease patients tend to have involvement of a small bowel, and ulcerative colitis, by virtue of losing excess of blood into the colonic lumen, they tend to develop anemia and other deficiencies. So these deficiencies need to be detected well in time and needs to be treated. So they will require multiple nutritional supplement, a special diet monitoring and counseling by the dietitian. So these will be important. And then there are certain lifestyle factors which are known to cause exacerbation. These are particularly stress events tend to precipitate the symptoms or acute attack. So stress management also will be very important. In addition to this, it is very important to continue medication very regularly. Medications we generally classify into two groups. One which is used to treat acute attacks or acute exacerbation of the basic disease, and there we use medications like which are known as corticosteroid. Some in general population, it's widely held belief that corticosteroids are very dangerous drugs and cause lots of complication. This may be right to some extent, but basically the risk depends on the duration of use, and short-term use the drug is extremely useful and the risk is minimal, and possibly we don't have as of now better drug available than corticosteroid for the control of the disease. But there is a completely new class of drug which is called biologics. There are multiple agents available in that. Those are also effective in control of acute episodes. They need to be, most of them need to be taken as injections at the interval of 2 to 8 weeks, but they may be expensive alternative to corticosteroid. Then we have another new class of drug which is coming in, not fitting in both the categories, is called a small molecule like tofacitinib and upadacitinib type of drug. Oral drugs can be, they are reasonably safe and very effective drug, they can be taken. So the patient has to, and then age-old treatment which is called 5-amino salicylic acid. So that is also available, that acts like a local anti-inflammatory agent that is continued for a long period of time. Sometimes what happens that patient need to understand, make a distinction which is drug for acute relapse, acute attacks, and which is the drug for maintenance therapy. Maintenance therapy drugs should not be stopped abruptly. Acute therapy drugs also should not be stopped abruptly, but they also need not be continued for long term, because then it can be detrimental. And then a patient should remain always in follow-up with the gastroenterologist, and generally during initial phase when the disease is active, he will require to consult every 2 to 4 weeks, and once disease goes into remission, possibly one consultation in 3 months should be good enough, and the regular blood and other parameters need to be monitored. Subsequently, what happens that if the disease duration becomes more than 8 to 10 years, then possibly some sort of surveillance also will be required for development of any gastrointestinal malignancies. And also there is some amount of risk in the family members for the occurrence of similar disease. So any family member starts developing the warning symptoms which I discussed in the beginning of this talk, so they should be evaluated as quickly as possible for the onset, because the risk of inflammatory bowel disease in the family of the index patient or first degree relatives of the index patient will be higher than the normal. So that should always be kept in mind. So simple precautions taken, most patients will have nearly normal lifespan if they continue to follow the diet and medication prescriptions. So and will live a healthy, productive life. So wishing you all good health, particularly those patients who are suffering from inflammatory bowel disease. Wish you good health.